I get the pleasure of talking about one of my favorite topics, and nobody ever talks about this. How many of you have ever been in a lecture on squamous dysplasia that wasn't my lecture? Like 2 people, okay? 2 people in one of the things that we see every single day. How many of you see biopsies of head and neck mucosal sites? Like almost everybody, right? It's bread and butter pathology. We see it every single day. It's common in our practice of surgical pathology, and yet we still don't talk about it. So I get to talk about it, and I like to, because I still find that even though it's a routine specimen that we see regularly, it's one that causes us great consternation on a regular basis. I bet you agree with me. These are the specimens, along with thyroid, which I'll also talk about, that we show around to everybody. Yes? Show it around. Now, I don't know about you, but in head and neck pathology, it's a little easier to show it around than in thyroid. In thyroid, I'm very selective. Show it to so-and-so because I know they'll agree with me. Right? In head and neck, we don't worry about that because we mostly agree. And so what I will show you today are some of the criteria and the histologic features that I use in my everyday practice. I do use them in my consult practice too, but this is really very general histology. It's very general features that you can use on everyday cases. The head and neck mucosal biopsies that come to you from every ENT surgeon that you work with. So we're going to go through the fundamentals, the basics, and then I'll show you some of my super secret tricks that I use all the time. They're not in books, they're not written about, they're just the things that I use very regularly. I'm also going to talk a little bit about some other areas. I'll talk about a few mimics and pitfalls. I'll talk about lichen planus and pseudoepitheliomatous hyperplasia, which is always one that comes up in the differential for some of these lesions. And then I'm going to talk about another problem area, and I know you deal with this too, identifying superficial invasion. So when is something high-grade dysplasia versus when does it become superficially invasive? I'm going to talk to you about that, tell you what I use. And then lastly, because I can't resist and everybody always asks me, even if I don't talk about it, somebody would still ask me, I'm going to talk about HPV and what we should be doing with HPV-associated squamous cancers. Okay, let's start.